It has been an incredible last 2.5 years at Central Health as we've been building a medical respite program for people experiencing homelessness so that people have a safe place to rest and recuperate, whether from a broken leg or a stroke, or whether they come in for surgery for the knee replacement or cataract surgery or chemotherapy for their cancer. I want to tell you about a gentleman I met last week, a respite patient. He is 60 years old. And he came to respite after being in the hospital for 10 days. He was diagnosed with kidney failure. And he immediately started to share how grateful he was to be in the program, for the caring and compassionate staff, for getting set up with a primary care doctor for the first time in his life, having a chance to see a kidney specialist, getting help with transportation, his medications, food stamps, housing, all of the things. And then he told me that he felt really bad because he almost left. And he said that when he first got out of the hospital, he was discharged to one of our nursing homes. And he said that he'd been cooped up for 10 days, that he was just so stir crazy that he just wanted some fresh air. And the staff at the nursing home said that, you can't be outside, you need to come inside, you're in isolation. And at that point he told me that he was so anxious, he panicked. And the next thing he knew he was on his way back to his encampment. And once he got there, he said he looked down at the concrete ground, he was sweating, it was so hot. And he realized he had made the wrong decision. So he found his way back to Sunrise Church and Navigation's homeless center in our community, told them what happened, and he said within 10 minutes he was on his way back to the nursing home. And when he got there, he was welcomed by one of our post-acute providers, Regina Evidente, who said, "I am so glad you came back." There was no shame, there was no guilt. She just said, "I'm so glad you came back. I went looking for you around the block, but I couldn't find you, and I'm just so glad you came back." And at that point, he started crying, and I started crying, and it was just so touching because he said, "This doesn't happen to people like me, that I would get a second chance, that someone would come looking for me." And then he shared that he left home when he was 13 because he was tired of the abuse. And I could only imagine what he had gone through. And we know that people who have had severe trauma in their early childhood years have higher rates of anxiety and have a heightened fight or flight response. And so I think that him leaving the nursing home might have been that flight response. And then he told me that 7 years ago his wife died and that he didn't want to live anymore and he just wanted to die. And that's why he didn't seek care when he started feeling ill. But he told me that because of the care that he had received with our teams, that he wanted to live and he wanted a better life for himself. So I think about in healthcare we talk about no wrong door, and in this case there was no door. We were able to help him wherever he was in our community, and so it's really neat to think that now we have Central Health providers embedded in the hospital, in the emergency room. We now have team members in the nursing homes, at the shelter. We even have an eligibility team worker at Sunrise Church. And so whether you come through the front door, the back door, the side door, no door, or you're not ready to come in a door at all, we are ready to serve you wherever you are.